Hello, my name is Jessica Beebe. My mentor for this project is Dr. David Locke, and I will be discussing how spirituality and the practice of beliefs affects preventative reproductive health care. First, what is spirituality? Spirituality is a belief in a transcendent or higher power in the context of my study. The question I will look to answer is, how does spirituality and practice of beliefs affect young women's delay on receiving preventative reproductive health care? Other studies have evaluated how other variables such as socioeconomic status and ethnicity affect this. My study should fill a gap in the literature that improves healthcare. As mentioned before, socioeconomic status and ethnicity affect healthcare relating to the accessibility of health insurance and how discrimination affects seeking of care. Spirituality is more personal and individualized, so this will provide a new avenue of patient care. I will use religious fatalism theory to test my hypotheses. Religious fatalism itself is belief that one's health is predetermined or purposed by a higher power, causing patient delay. My hypotheses are that as spirituality increases, there will also be an increase in patient delay. Spiritualities with high fatalistic beliefs will have a higher increase in patient delay. Also, the spirituality of an individual, as it increases in importance to the individual, will also increase patient delay. My study will be conducted in two phases, with the first phase being a data analysis of GSS data using a 2002 topical they did on healthcare, while my second phase will consist of qualitative interviews to add validity to the findings from my first phase. Some of the important independent variables I will use to test my hypotheses in the first phase are religious preference, whether they consider themselves a fundamentalist, strength of affiliation, and practices like prayer and attendance. Dependent variables include trust in their doctor, reliance on doctor's knowledge, or judgment of the doctor. The statistical methods I will use to test these variables are Pearson's R correlations, which will be used to measure the strength of a linear relationship between spirituality and patient delay on the interval variable level. Spearman's rank correlations will be used to measure the strength of correlation between spirituality and patient delay on the ordinal variable level. Then a multiple regression model will be used to compare all the variables while controlling for the confounding variables. In my second phase, I will be asking some basic demographic information leading into interview questions like, how many times a day do you think about your God or transcendent? And then hypothetical situations of health circumstances where the individuals are put in situations and then are asked to rate on a 5-point Likert scale how likely they are to seek health care is going to be used. An example of this would be, you have been feeling slight pelvic discomfort for 2 weeks. How likely are you to seek care? 1. I would not seek care. 2. I maybe would seek care. 3. I would seek care within a month. 4. I would seek care within 2 weeks. And 5. I would immediately seek care. I will have 2 years to conduct this study. In the summer of 2019, I will refine my measurement tools and finish all my IRB requirements. In the fall semester of 2019, I will do my GSS data analysis. In the spring semester of 2020, I will conduct my qualitative interviews and transcribe them. In the summer of 2020, I will triangulate the data between the GSS data analysis and the qualitative interviews that have been done. In the fall semester of 2020, I will finish my senior thesis paper and present.